So this will just kind of be a little bit of a brief talk about ethics, or not. Actually, ethics do come into the law, but meaning more about law and legal things, considering our nursing license. So to start off, I'm going to give you a little scenario. So you're an LPN, so put yourself in in the role. You're an LPN assigned to 30 residents at a long-term care facility. You're administering medications and supposed to administer a heart medicine. The apical pulse must be taken before the medicine is given. The nurse feels she just doesn't have time to stop and take the pulse. When she charts, she looks at the record of the previous pulse counts, and then arrives at kind of an average where it's been before. She documents this pulse with the medication. I see some concerned looks. So, what is this an example of? Is this ethical behavior, unethical behavior, abuse of power, or deonatology? Yeah, what is deonatology?
Study of beyond.
So you're right, this is unethical behavior. If we're documenting something, that's part of their legal medical record, right? And we're falsifying that documentation. We didn't actually do or check the pulse like we're documenting. So let's go back a little bit. So the overarching kind of thing is we're talking about personal values. So ethics is a branch of philosophy that looks at ideal human behavior, kind of like what would we hope everyone does. Ethics and then your own personal values get intertwined to determine what you do in your life and your nursing practice. And then different societies and cultures have different ethics. It's important to know that what might be important to you or what might be a very ethical dilemma for you might not be the same for somebody from a different culture because their ethics might be a little bit different. So ethical dilemmas that are situations that result in a what of two or more fundamental values? Is it a conflict or two or more fundamental values, a blending, a change, or a discussion? Yeah, you're right. It's a conflict, right? We might feel like when we talked about ethical dilemmas in nursing, that discussion board we did earlier in the term, you guys did a really good job at kind of thoughtfully looking at some of the ethical dilemmas. There's certain times where we might not agree with a patient's choice for their own healthcare, but we also strongly believe that patients should have autonomy, that we should be advocates for patients to be able to make that choice. And so that's when there's a conflict of those things. So personal values, those are our underlying principles for ethical behaviors. It's what we believe about the truth, our thoughts, behaviors. And then, like I said, the dilemma is when we have a conflict of two or more of those fundamental values. So as nurses, we have to develop a framework so we know how to make these types of decisions. Because if we're going to face, and you will face ethical dilemmas every day working at it as a nurse, it might not be a huge dilemma. You might not have a lot of turmoil inside with it, but every day there's probably going to be some small dilemmas. Even if, when was it? I worked on call the other day and I had a patient who I was so frustrated with him because he knew he was going to have surgery. He was a type 2 diabetic. He was very non-compliant. He had had 5 of his toes removed on one foot because he was non-compliant and had blood sugars that were way out of control, had neuropathy, low blood flow, ended up having some wounds and having to have amputations. He was back for more surgery, probably going to have more of his foot amputated. He came in because I didn't check my blood sugar. I forgot, and I figured you guys would. Okay, well, you really should be checking your blood sugar when you wake up. I'm asking him about his medicine he takes at home. He goes, oh, well, I have my blood pressure medicine, but I don't take it. To me, it was very like that's an ethical dilemma for me because there's one part I want to support his autonomy. He can make these decisions, right? These are his body. He can choose. But there's part of me that's like, oh, you're just going to keep causing more and more problems in your own body. Like you're going to have to keep coming back for these. If you're not compliant, this is not going to get better on its own. In fact, it's going to get worse. And then there's an even bigger, not bigger, but there was a small part of me that was also had another ethical, and another part of this was a dilemma for me, because he was on state insurance. And so I knew that he personally wasn't paying for this, but our state was paying for the surgery. Our state's paying for his medication, but he's not compliant. And he's going to keep having more and more hospital stays, more and more surgeries, more and more things because of his decision that ultimately will, like, that affects our state's funding, right? And so to me, I'm like, man, this is a really hard thing, but as a nurse, all I can do is educate and support, right? From that standpoint. And honestly, right before surgery, was that the time to really tell him that he was doing all these things wrong and he needed to change all these things? Not really. There's encouragement. There's kind of like, oh man, I wish you would have still taken your blood pressure medicine. If you have it at home, let's talk about maybe some of those barriers. But really, it's not the time to do all this big education because he's nervous before surgery. He's not going to remember any of that. One thing to know is that there's intuition. A lot of times, have you guys heard of nurses' intuition? Yeah, or that sometimes people say personal intuition, mother's intuition, father intuition, some whatever intuition. That's a feeling that you should or shouldn't do something. And you guys are going to feel that. There's going to be times when you're just like kind of nervous, but just like I tell you, like I feel like I try to tell all my students, like it's okay to be nervous. Don't be nervous alone. A lot of times that little nervousness, that piece that you feel, that might actually be your intuition saying, I don't know what's going on. I can't identify, but something makes me nervous. It makes me feel like there's something going on. Follow that. Because a lot of times as a nurse, even now, you guys have done so many assessments. Remember when you're first starting the program and you were learning how to do head to toe assessments, like how overwhelming that was? Think about how many assessments you've done on how so many different patients through the course of this program. You guys have learned a lot. And so when something hits you and you're doing an assessment, you might not realize what's making you a little nervous or making you feel something different. It's probably something you learned along the way. So listen to your intuition. What's another term for ethical behavior? Mandatory, lawful, appropriate, or ideal? Ooh, kind of different. So ideal is actually, it's talked about ideal behavior. Appropriate, I can see where that can be kind of confusing because we think, well, appropriate is the right thing to do. But when we talk about ethical behavior, it's about ideals. What would be the ideal thing to do in a situation? So some of the ethical principles that we use, autonomy, everybody has a right to make their own decisions, right? We have to respect that. Beneficence. That's that we do what's good for the patient, right? We're not going to choose to do something that would cause that patient harm. Non-maleficence. That's the opposite. That's where we're not going to do things that we know will cause harm to the patient, right? If a provider gives you an order and maybe it's written and it says what it looks like is 1,000 units of insulin or something, you're going to question that, right? You're going to go, I think that would kill him. I would like to question this. Yeah, that would, because giving it, knowing that it would give harm just because it's ordered, would be maleficence. Justice, being impartial and fair in what you choose to do. Fidelity is being faithful to promises or agreements. If you receive an assignment, right? That LPN, who poor gal had 30 patients, I think, did it say? That was her assignment. Leaving it is a lack of fidelity and patient abandonment. Just a reminder, you do not have to accept an assignment that you feel is unsafe, right? You go in and you feel like, man, I don't feel like this is safe. Use your cusses, right? Like maybe that sounded, don't cuss, but like cuss, say, I have a concern. I feel like this might be a safety issue. Talk to your supervisor, whoever is in charge over you. And then veracity, being truthful and honest. In that scenario where the nurse was making up numbers for her vital signs, she was not having veracity. She was not truthful in what she was doing. There's some ethical issues that come up with nursing. I think about genetics, right? So there's a lot of possible ethical dilemmas that can come up with kind of genetic, genetic, what's it called? Like where you can choose If you're doing like in vitro fertilization, do you want to choose the male versus the female? Do you want to choose, if you,
Selective,
what's that?
selective. something?
Selective choice, right? And so that can have ethical dilemmas in it. Bioethics, it's kind of a newer, evolving, area of science. I'm really curious that, did you guys see how they, what did they pulled DNA from like the ice somewhere, and was it saber-tooth tiger? Not saber-tooth. A dire wolf.
Yeah.
There's like 6 dire wolves that have been extinct for a long time. And now they have these new dire wolf puppies because I don't know the magic behind the science, but somehow they were able to get that DNA and replicate it and now have these little babies. It gets like, we look at that when they're wolves and we think, okay, that's interesting. But you can also translate where how some of this might become part of what happens with people as well. And that can be an ethical dilemma for us, especially if we're, involved in some research, involved in caring for some of these things. So it can be very tricky. Ethical theories. All right, here's our deontology. That represents your duty to fill your duty to yourself and others to fulfill your obligations. It means to do no harm. And it usually is based on rules and societal norms too, right? Every societies have different rules. Utilitarianism, that represents how useful a decision is for the greatest number of people. So that's based on, hey, if I make a decision for a society, I'm going to look on what would benefit everybody overall, not necessarily the individual people. Utilitarianism often leaves out what group? Yeah, it's those that are a minority, right? Because if we're looking at what's good for the overall, those that are in a minority might be missed or their needs might be overlooked. So steps for ethical reasoning. You guys did a really good job when we did the discussion board for this. So I'm not going to go over this all together, but no, when you're having an ethical dilemma, you don't want to just sit with the dilemma itself. You want to actually work through it. Identify why you're having a dilemma. What are your personal values? How do you respond? Go through that. Let's move on to some legal issues. So as LPNs, you're going to be having to provide care with the established standards. If you neglect to do so, it's actually a criminal act. So it's really important that we know what we're like. Actually, shoot, it's on there. I was going to say, how do you know what is in your standard of like how to care for people? The Nurse Practice Act, right? Like you guys, we all practiced kind of looking up on our what was our delegation, or where you had to delegate an assignment to somebody else, you have to be able to go to look to see what is acceptable for me in my scope of practice. That was it, scope of practice. So the Nurse Practice Act, it sets forth legal requirements for the state where you're in. So let's say you start as a nurse here in Washington. If you move to another state, there's going to be a different Nurse Practice Act. Now, it's probably going to be very similar to Washington because overall, they're all pretty similar. But you want to make sure you look and note if there's any differences. You're responsible for knowing what the Nurse Practice Act is for the state you're practicing in. So the State Board of Nursing, they're responsible for establishing like what the nurse practice licensure and education is for each state. They can only enforce rules that are in the Nurse Practice Act. So if there's something that you do that's unethical, that's not identified in the Nurse Practice Act, the State Board of Nursing is not going to be the one that will punish you or maybe enforce things with you. They do provide disciplinary action if you break some of the rules provided in the Nurse Practice Act. They could punish, meaning take away your license or require certain things of you to remediate, essentially. So the Nurse Practice Act is an example of which type of law? Common, statutory, institutional practices, or criminal? Interesting. All right, and it's a statutory law. It's institutional practices. See, do I have it on here? So institutional policies and procedures, it's not the same as the law, but that's where, like, let's say you're gonna put in a Foley catheter. Every institution that you work in should have a policy and a practice of how to put in a Foley catheter. That you can go to that and you can follow those steps to guide you of how to do that. Foley catheter is one example. There's lots of other ones. So statutory law, that's laws. There's enacted and regulatory laws. So enacted laws, those are formal laws that are passed in society. And then the regulatory laws, those are like the State Board of Nursing. Those are the laws that they make. Common law, that's where, like, if you've seen some of those court, what is it, like the CSI or the, like those TV shows, and they're always referencing other cases. They're like, oh, well, there was this case in this year on this date, and this is what happened. And so we can use precedents. That's what common law is. It's where there's not necessarily a law that says what's right or wrong or what to do with the scenario, but you can go back and reference previous things that have happened and kind of base whether something's right or wrong based on that. It's common law, I think of like as common sense, common understanding usually. We kind of understand this is what's right or wrong. One thing with institutional policies, they do not take precedence over the law. If you look up how to put a Foley catheter in and it says, first of all, take a pillow and smother it on your patient's face, then go ahead, once they stop breathing, put in the Foley catheter, like that's manslaughter, right? Like that is illegal to do. Yeah, I took that kind of extreme. I didn't mean to go so dark. But what I mean is if there's something in the policy and you're like, what is this thing? That's clearly not right. If it's violating another law or somewhere else, you're not going to follow it. It doesn't take precedence. You can't go and say, but my policy said to do this. If you're like, no, that you can't. And most places, especially in healthcare, their policies and procedures are very up to date, very current, very aligned with the law. But just so just in case you see something, the law always will have precedence. Criminal law relates to public welfare. So crimes are punishable by imprisonment, probation, you might lose your license or fine. And it's any violation of the law that governs, or any violation of the law that governs nursing practice is considered a crime. So civil law, that's between organizations or individuals. So there's a couple of, no, it's not this. But one thing to note, sorry, I'm kind of reading as I go. Nurses who break the law, you might have there you go. You might have a civil or you might have a criminal law case, right? Like if you break the law, you break the Nurse Practice Act, that might be a criminal case. You might also have a civil case too, right? You might get punished by the State Board of Nursing and get your license removed. You might also get sued by a family member or something if there's like a negative event, right? There can be two separate types of things. I hope none of you ever have to have any of that go into that as an issue. Okay, so a couple of things we know. Standard of care. Standard of care is something that we need to understand, like what is that is the minimum requirements that you need to take care of a patient. Standard of care is usually set forth by your institution, and it's usually comparable across board. So if you're working, like you guys have clinicals in the hospital, every department is going to have a different standard for how often you have to take some patient's vital signs, right? If you're in the intensive care unit, sometimes you're taking them every 5, 10, 15 minutes. But if you're on like a rehab unit, that might be every 8 hours or more sometimes. If you're at long-term care, sometimes those patients are like on a once a week vital signs or once a month. So it's a standard of care for wherever you're at. It's important to know, right? Because you wouldn't expect somebody on a rehab unit to have to get their vitals taken every 15 minutes. That would be ridiculous. It's not necessarily. And then there's also the duty to seek medical care for the patient. That means that we have to be the advocate. If we know that something's going on, we have to go forth and say, hey, I'm concerned. And if we don't get anywhere, right? If maybe we go to the provider, we cuss them, we say why we're concerned, and we don't get anywhere, but we know that this is wrong, that it's going to result in something bad for our patients, we have a obligation to do everything we can. So we might be going to our supervisor, to somebody else. We're going to follow our chain of command to get help for that patient. Good Samaritan law. It's developed to help protect those who give voluntary assistance in emergency without expecting to be paid. A lot of the times, especially when people maybe see a traumatic injury or an accident that happens in the public, a lot of healthcare providers are worried that helping those patients might open them up to be part of a lawsuit. And so what this does, the Good Samaritan law, essentially it covers you, saying if you arrive to a situation where there is an emergency, as long as you are doing everything, you know, you're not, if you, okay, so for instance, years ago, I was driving along, oh gosh, Sprague, right over here. And it was in the evening, it was kind of dark, and it was a long day. I won't go into it, but I was so tired. And as I was driving, right in front of me, the car in front of me, I heard something. It was so loud. It was like a boom. And I was like, oh my gosh, did he just hit a dog? And as I was thinking that, I saw a shoe fly by my window. And I went, oh no. And so I pulled over, and the guy in front of me had hit a person that was crossing the road. And, lots of factors. It was dusk, hard to see. The guy was walking across the middle of the street, right? It wasn't a crosswalk. He was dressed in very dark clothing. Fortunately, it was 7:45-ish, I think. And so that shift changed for a lot of the hospitals, Tacoma General, TG. So I pulled over, and then one of the ER techs from Mary Bridge pulled over as well. And he was not breathing. His heart wasn't beating. And so we started CPR. And it was horrible. It was awful. I really think and I hope he was dead then, because he was just so gravely injured. We were really lucky that just a few minutes into CPR, there was an ambulance that stopped. They were actually a pediatric transport ambulance, but they came by the scene. And so those EMTs stopped, even though it wasn't their call, like they hadn't been called to help. There was other ambulances on their way. They stopped to help us as well. Before they got there, the neighbor across the street heard what happened, and I was doing CPR. So CPR, like you guys have all done your BLS, right? I wasn't prepared for it. I've done CPR dozens of times on people, but I've done it in a hospital in controlled situations, but in a situation where I have my nurse hat on. I'm ready to respond to a code. I know what to do in a hospital or a healthcare setting if somebody's heart stops beating or if they stop breathing. I'm good. But this came out of the blue. I was not prepared for it. And his chest felt like a bag of marbles. He was just crushed on the inside. So doing CPR, if you remember from your BLS classes, if you've done it, it looks aggressive, right? Like you are really pushing on a patient's chest. You need to do it hard, you need to do it fast, and it looks pretty awful. The neighbor across the street was a middle-aged, very large man, and while I was doing CPR, was screaming at me, telling me, what are you doing? You're beating on that man's chest. You're killing him. Stop that. And he was just like, I don't think he was frothy on his mouth, but he was just so angry. And I remember being terrified that he was going to hurt me or like hit me or like try to like do something to me. But I was like, I can't, if I stop this man won't have any chance of living. Fortunately, there was this little teeny tiny nurse practitioner that had also just gotten off shift from Tacoma General. And she went and got in his face and she was like, she is doing CPR exactly how he should. You need to step away because you are uneducated and uninformed. And she like totally went to town. And I felt so much safer because she got him to kind of move away where I didn't feel like I was in danger. And then shortly when the EMTs got there, they said almost right away, they're like, he's dead. There's no coming back from his injuries. They were too grave to recover from. His heart still wasn't beating. He still wasn't breathing. It was awful. But you can see where if that was family member or somebody that saw me doing that, how they might get very concerned that I was harming the patient, that they might want to try to have like a lawsuit or something to say like, no, you're a healthcare provider. You should know better. You should do something better. And so me in this situation, I was protected, as we all are as healthcare providers, by the Good Samaritan law, that even though I couldn't get a report on him, right? I don't know. My guess is there was probably, and I can't follow him, so I don't know his toxicology, if he was high or drunk. Maybe there's mental health issues. I don't know what the issues were. But all I knew was if he's not breathing, his heart's not beating, I need to try to do something to help him to try to live. Right. And even though, I don't, maybe he had some other issues, I don't have to know about those. I just have to act in his best interest for that emergency situation. And so you're all covered in that, right? If I went and maybe it was a different situation, but somebody's doing something and I decide that I'm going to start an IV in their neck because I feel like that might be better for them. I'm not really covered by, right? Like that might be a little bit different than an emergency situation. If you can, always get consent from the patient, right? So in the situation, if that patient hadn't been so gravely injured, if there was something going on, but I wanted to help, move him off the road and he was still conscious, but hey, can I come help you, sir? You want to talk to them and ask them for the consent to help if you can. This is so long. Okay. Which nursing action ensures the patient's permission for treatment? And really it's explaining to patients the procedure that you're going to do and what to expect. You don't have to go through because those are so long. Okay, so confidentiality, right? We all have learned about HIPAA. We've got to keep patient information confidential. So important that when you are using computer charting, that when you're done, you lock down the computer. Do you guys know on Windows-based computers, if you hit the Windows button and then L, so hold down the Windows button and then push L, that will log you off of any computer. So a lot of times you have to sign into things. That's just an easy way because some people, I don't know, for some reason they're like, oh, I have to hit this and this or badge or whatever, and that's like a barrier for them. You can just do Windows L and that will log you out as well. Make sure you secure whatever your workstation is so somebody else can't come behind and see. Also really important to have private conversations about patients off stage, right? Even if, like I'm having a conversation here, I don't see anybody, but maybe right around the corner here, there's a few people. Maybe it's a patient's family member that I'm talking about, or, we want to make sure that it's off stage where we know there's nobody that might overhear. Then we also want to have permission to retreat. Part of this is everybody has the right to refuse as well, right? Even though somebody, they might say, hey, you need to take this blood pressure medicine. And maybe the guy goes, I just don't want to. I don't like however it makes me feel, some of these side effects. I would rather have the side effects of high blood pressure than I would this medicine. As long as he's informed of that, that's his choice and he can refuse. If somebody does refuse treatment, what's something important that we have to do as nurses? Document, always document. And you don't have to make it this huge thing. You can just say, offered, blood pressure medicine to patient refused, states, and you just want to quote whatever they say. And then you might also say, instructed patient or informed patient of possible risks of refusing medication, and then just patient states he's aware. It can be very brief, but you just want to make sure you document. A nurse writes in a chart that physician is unreasonable and refuses to prescribe morphine for a patient in pain. If a nurse charts this, what is an example of? It's actually libel. Slander is something that you say. So think of the S's. Slander is something you say. Libel is something that you write. So I think of libel as literature, like literature is written word. Libel is literature. It's something written down. Informed consent. We've talked a lot about this, but we've talked about the nursing part as well. It's not that we're signing consent for the patient. It's we're signing that the patient understands the procedure and then the risks and benefits that the doctor, provider, whoever it is, has informed them. Defamation of character, that's sharing information with somebody that's malicious or false. Doesn't necessarily have to be, even if it's true, if it's malicious, right? Because if we go back to the question, the nurse says he's unreasonable and refuses to provide morphine for patient in pain. Well, the provider maybe refuses to provide morphine or to order morphine, and maybe the patient is in pain, but unreasonable is a very objective word. We don't really know what that means. It's definitely a little bit inflammatory. I wouldn't write this in somebody's chart. Usually what I would write, if there was somebody who I really felt needed pain medicine and it wasn't ordered, I would just document, I would say what the patient's situation was. I would say, requested pain medication, and then that the provider does not order anything at this time or will not order anything at this time. And then something like that, but I wouldn't say that they're unreasonable. That's not a very nice or not appropriate thing to put in your charting. So libel is when it's in writing, and slander is when it's verbal. You're saying something. Advanced directives. Those are something that are also really important. It helps patients to make decisions before those end of life times. And durable power of attorney often goes hand in hand because the advanced directive will let us know how do we treat patients when they're gravely ill. Durable power of attorney lets us know, is there somebody else that if you can't make decisions, that you want to make decisions for you? So it's important that we provide those options for our patients. A lot of hospitals will have people who can give them information about those documents, people who can sign or notarize those documents for them to help give access to people with those. I already talked about this. So negligence. So you have to meet the standard of care. And like I said, the standard of care is going to be different depending on where you work. When you fail to follow it, then you could get in trouble. But there's a few things that to prove that you didn't meet the standard of care, they have to establish that one, the standard of care existed. So they have to make sure that there is a standard of care. They have to also show that there was a breach in the care, that the nurse didn't do the standard. Then not only did the nurse breach it, but there was injury that resulted from that standard of care. And then also that there were damages or there was something wrong that happened as a result. So if you're going to be charged with negligence as a nurse, all those things have to fall into place. Maybe you make a mistake and you don't follow the standard of care. If nobody is injured, then you're not going to be charged with negligence because there wasn't an injury to the patient. You want to make sure that if you realize something, I'm all about reporting internally, because if there's an issue that happens with you, my guess is it's probably happening with a lot of other people. It's probably a systems issue a lot of times. So let's say there's for some reason, whenever you're going to give amlodipine or Norvasc to a patient, it doesn't show up on their MAR. You know that every patient who's on Norvasc, you've got to click on this other area on the MAR to see if it's due. You know that happens. So you make sure you do that. My guess is a lot of other people miss giving amlodipine because they have to go click somewhere else and they miss it or don't know. That's a systems issue that we can fix. Let's see, malpractice. That's negligence from somebody that has a license. Fraud is deliberate deception for purpose of personal gain. They talk about fraud in healthcare a lot about finances, right? About the different charges that we charge patients. It's a lot of times patients, I don't know if anybody's ever told you, they look at their bills. And that's what the one guy told me. He goes, I didn't check my blood sugar because I knew you guys were going to do it anyway, and it's $50 charged. So I was going to wait for you guys to do the expensive one. I was like, I don't understand that at all. But it's fraud. If we're saying maybe there is a $50 charge to check a blood sugar. And if we check their blood sugar 3 times in a shift, but we're charging them for 6 times in a shift, that's fraud. That's taking money for things that we didn't do. Assault is threat of unlawful touching somebody. And then battery is if you actually do put hands on somebody. Now in nursing, the only time I've seen this, I guess there's angry people, but usually they talk about if you're having to restrain somebody, if you're having to, hold somebody for their own good. That's why I always say, if you have a patient who's violent or needs restrained or there's questions, have somebody go with you, because you want somebody else to be with you that can back up and say, oh, no, no. I know that Cameron didn't go like, drop an elbow on this guy, like, like we were just holding him down because he was trying to hit the other nursing staff. Go in pairs or groups. False imprisonment, again, right? If we are restraining somebody, if we don't do that in the proper way, we could be charged with false imprisonment or not letting somebody leave their room or the hospital. That could also be false imprisonment. You have to have proper documentation to make somebody stay where they're at. So how do you prevent a lawsuit? A lot of you guys did a good job with this one, right? Know your institutional policies, know procedures, know your patients too, right? Know what's going on with them. That's going to help you. Record and report what happens, and then question everything. If there's ever a concern, don't leave that concern inside of you, right? Go find somebody else. Go find the answer to your questions. Okay. Last question. What stuck out to you the most that we learned in this short little lecture? Libel. Libel is literature. All right, so let's go ahead and break up into groups. I've got a little group thing to do before we go into our Jeopardy. All right, so bag of equity will determine who our Jeopardy groups are essentially. Gotta brace down for it. Stretch a little bit. Purple. You guys want to go purple? No, or your Jeopardy going? No, all right, I'm just, I'll take the. I'm ready to go. So ready for it, I'm so excited. That's been so fun, I know. I did that. Right, different or something. Where are you going? Start. Awesome. Again, the last like 4 times. Right. You guys have your papers, go ahead and break up the group.
I don't know.
I'll show them.
I'll let her like that. After, yeah.
A tree?
Amazon.
Mhm.
45, is that okay? Because there's a care home being like not audited, but this thing's, so
Gosh.
they need to be there because of my